Okay, let's try this again, okay? It's Friday, April the 16th. We didn't have our microphone on just a second ago, and so bear with us. I said that we have regretfully lost 21 additional Great West Virginians since Wednesday. You know, I'll get into more detail about this. I caution you over and over and over about, you know, all the things and the precautions about wearing your mask and all that, and I'll get into more of that in just a few minutes, okay? Our 2,757th death is an 80-year-old female from Kanawha County. Our 2,758th death is an 80-year-old male from Jefferson County. Our 2,759th death is an 80-year-old female from Pendleton County. Our 2,760th death is a 65-year-old female from Jackson County. Our 2,761st death is a 55-year-old male from Cabell County. Our 2,762nd death is a 53-year-old female from Marshall County. Our 2,763rd death is a 78-year-old female from Lincoln County. Our 2,764th death is a 76-year-old male from Marion County. Our 2,765th death is a 92-year-old male from Wayne County. Our 2,766th death is an 85-year-old female from Braxton County. Our 2,767th death is a 90-year-old male from Upshur County. Our 2,768th death is a 62-year-old male from Putnam County. Our 2,769th death is a 56-year-old male from Nicholas County. Our 2,770th death is a 92-year-old female from Brooke County. Our 2,771st death is a 58-year-old female from Nicholas County. Our 2,772nd death is an 84-year-old male from Upshur County. Our 2,773rd death is a 64-year-old female from Jackson County. Our 2,774th death is a 45-year-old male from Harrison County. Our 2,775th death is a 42-year-old female from Logan County. Our 2,776th death is a 95-year-old female from Jackson County. And our 2,777th death is an 84-year-old male from Wyoming County. 2,777 deaths in West Virginia. In the last 24 hours, we've had 475 new positive cases. Our daily percent positivity rate is at 4.31 for the last 24 hours. Our cumulative percent positive of cases is 5.21. Our active cases are 7,272. Our recovered cases are 136,272. We have 234 people hospitalized in West Virginia and 57 in the ICU units. And we have 2 red counties, that's Boone and Berkeley counties. Over and over, I tell you about, you know, if you're 65 years of age and older, to be sure that you go get a test. If you do and you're positive, we'll get you the antibodies and we'll probably be able to save your life. It's been detected in West Virginia in the last few hours and everything that we now have the Brazilian variant in West Virginia. It's called the Brazilian P1 variant. It was identified in Berkeley County. There are currently 497 cases in the United States in 31 states. Please stay, you know, on your guard in West Virginia and get vaccinated and do all the stuff from wearing your mask. And Dr. Amjad will have more about that in just a few minutes. You know, as far as the breaking cases in West Virginia, you know, and throughout our country, I need to report this to you just this way. You know, there's going to be somebody out there that's going to say something like, well, hold on here. You know, if you get vaccinated and everything, you're not going to get this thing back and everything. And the odds are so phenomenal that you're not going to get it back. It's just off the chart almost. And then, if you'll just step back and think just about this, we've tested in this country, or we've given vaccines rather in this country, I think it's 77 million Americans have chosen to be vaccinated in this country. 77 million people have been vaccinated. Now, of those that have been vaccinated, there has been such a small amount that it's almost not even measurable that have gotten this disease back. I mean, when you're looking at a number like 77 million people, to think of 5,000 or 6,000 out of 77 million that have picked this back up, it is so minuscule, it's off the chart. And when you think of 77 million people in this country, that a sprinkle, and it is just a sprinkle, that have been vaccinated have died from reconnecting with COVID. Can you just imagine 77 million people have been vaccinated and less than 100 of them have gotten COVID back for whatever reasons we don't even know and maybe have died. Now, and you're going to take the chance in life. Let's just be brutally honest and terribly fair. In anything that we've done throughout time, any vaccines that come along, the vaccines for measles, the vaccines for smallpox, the vaccines for polio, all the different things that we have come up with over all the years, there has never, ever, ever been a vaccine that is this productive and this absolutely successful. Never. Never anything that I can ever think of, and I'm not a doctor, never ever that I can think of anything that protects you and has done this level of the job. Now, if you want to cling to the exception beyond belief and ignore the likelihood of you getting this or you giving it to somebody else that is a loved one of you and them dying, if you want to do that, well, I guess that's your right. It's a shame in many ways, because what you may very well do is you may very well be able to just transmit this and you not even get sick and give it to someone and it ends up dying. Absolutely. The numbers are in, and the numbers are astounding. They're astounding how safe these vaccines have been. Absolutely. They are astounding of the success ratios of how these vaccines have performed. If you choose not, because someone has scared you with the dark of the closet, if you choose not, the odds are really, really against you. The odds are astronomical against you. Now, our health experts will probably elaborate a little bit more, but I'm telling you, this is an absolute no-brainer. It is a no-brainer beyond belief. If I could just say this, you would almost be more prone to have a meteorite hit you in your front yard than you would to draw a terrible sickness from taking the vaccines. You would almost be in a situation without any question. Every single one of us that gets in a car every day, you are 1 billion times more at risk being behind the wheel in an automobile than you would be to take a vaccine. But if you don't take the vaccines, I just read 21 more. Every day that goes by, I read more and more and more and more. The only way I can stop this is you take the vaccines. In regard to the J&J vaccine, it is important to remember that while J&J remains paused now, we are not seeing these events in any way with Pfizer or Moderna, and that the vaccination is still the key to addressing this pandemic. We do have the Pfizer and Moderna vaccines. We're waiting to put them in people's arms. Eligibility-wise, everybody's 16 and above. We encourage our young people. I really didn't know this, but it came to my attention the other day from one of my assistant coaches. Now just think about this. My basketball team was offered, from what I understand through my assistant coach, was offered, to be vaccinated. And for whatever it was, I'm sure it was not presented in a way that where kids, would just jump on board. None of them decided to be vaccinated. This was weeks ago, a couple weeks ago. It kind of dumbfounded me that the way one of my assistant coaches, that was at the school, presented this. But nevertheless, day before yesterday, and the days are all running together now, but this was on Tuesday, so day before yesterday, on Tuesday, we played a game. One of the kids on our team that's a freshman that didn't, the game was very, very close, and she didn't get in the game. But lo and behold, out of the clear blue nowhere, she ends up positive for COVID. Now, I am telling the young people, I am telling the adults, we've got to get our children tested. We have got to get our children tested. All kids 16 and above, and especially our college kids and everything, the transmission rate is unbelievable. We have got to get our young people tested. Or not tested, vaccinated. We're at 84.8% on the vaccine distribution update. That is incredibly low as a percentage, and I will promise you that state after state after state is running significantly ahead of us now because we don't have arms to get them in people right now. We need people to step up, help us to be able to get arms for the vaccines. Saving our wisdom, we have 260,000 people that's 65 years of age and older. No telling how many thousands and thousands of West Virginians that we saved their lives because we moved. We didn't mess around with it, we moved. And we got it in arms of those 65 and above. We're above 75%. Our goal is to get to 85%. We got to continue to push to be able to get people because we still got 80 or 90,000 people out there that don't have the vaccine yet. In our manufacturing outreach and everything, we continue to call upon our businesses to absolutely, call us. We'll set up a time where we can come and vaccinate the employees that are working there. The same thing goes for churches. The same thing goes for our schools, whatever, where we can vaccinate kids or congregations at our churches. The COVID-19 vaccine info line is up. The vaccine reminders, like I've said over and over, the vaccine is absolutely safe. We need to be taking it. All of our standpoint, from the standpoint of our free testing, and our free testing map is up. From the standpoint of thanks to Walgreens and Fruth, I do it every day, and everything, they've done great. We have 10 outbreaks in our long-term care facilities. We have 4 outbreaks in our churches. Our churches, again, are stepping up. We have only 3 counties, that's Fayette, Grant, and Nicholas County. All that's significantly better. At corrections, we have 67 inmate cases and 7 staff cases. We continue to vaccinate at our correctional facilities. We have 39 at our Salem correctional facility, that's inmates, and 13 at our Southern Regional Jail. All the guidelines, like I've said, are up there. All the requirements about face coverings and all that, and everything from the standpoint of giving blood and everything. And the only other thing I want to say is we've been made aware that some state employees are choosing not to be vaccinated because of a false rumor that's going around. Now get this one. People are saying that because the vaccines are only approved for emergency use, that in the incredibly small chance you would still some way, somehow die. Now, that if you were to die from COVID, that PEIA won't pay out on the life insurance benefits. And this is, oh goodness gracious. This is a crazy place. And rumors fly around everywhere. All I can do is tell you, I have told you over and over and over, West Virginia, that absolutely I will always tell you the truth. I will never, ever tell you anything that I knowingly know is not the truth. Now, I'll make mistakes, but this is absolute crazy stuff again. This is completely and totally false. You know, I remain very confident that the vaccines are safe and effective as it can be, and your risk of dying is practically 0.00000, 1,000 zeros and maybe a 1 on the end of it. But you're absolutely probably more prone to taking a shot and walking under a ladder and somebody falling off the ladder and smashing you. I mean, it is. But if that were to happen, you're absolutely still going to receive, or your loved ones are still going to receive the life insurance benefits. There's nothing to the rumor. Don't let a lie scare you out of getting these vaccines, because if lies scare you, or myths or taboos or whatever they may be, out of getting this vaccine, and then all of a sudden you're laying there gasping for your breath, or one of your loved ones is doing that, it's not a very good situation. It's not a very good feeling. Now, I have said it, and I am exhausted, to say the very least, in saying it. You have got to get vaccinated. If you choose to listen to this garbage, just like this rumor that's going around, right, saying that, the PEIA, that your life insurance benefits are going to go out the window and everything and all this kind of stuff, that is just another step that somebody is trying to do so you'll go along with them. Over and over, I tell you just this: misery loves company. Misery loves company. And these miserable people that come up with these terrible rumors, they want you to be right with them. Misery loves company. Don't listen to this garbage, please. You're too good, West Virginia. Too good to listen to this garbage. Don't let these people hold you down. You see, that's their only essence in life. They want to pull you down all the time. I want to turn you loose to do all the greatness that I know you can do. They want to just pull you down. Don't listen to this garbage, please. That's all I got.
Thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning, and I want to absolutely reinforce what the governor has told all of us, is that it is so important that we choose to be vaccinated. And the information that he shared just recently came out of the Centers for Disease Control. And in looking at 77 million Americans vaccinated, they found out that there was only 5,800 cases of COVID-19 still being investigated as to whether those people had lost some immunity or whether some variant viruses are at play. Of those 5,800, 396 people required hospitalization and only 74 people died. So as we look at all people with COVID in the United States, we have a case fatality rate of 1.8%, meaning that 1.8% of all the people that we've identified as having COVID-19 have died from that. 565,000 people in our country, about 3 million people around the world. With vaccination, that case fatality, which is 1.8 for everybody who gets COVID, went down to 1/10,000th of 1%. So as the governor said, 0.00001. And so as we look at the impact of these vaccines in real world situations, we know these vaccines are incredibly effective and incredibly safe. And so as we look at West Virginia and we see that, as the governor said, that our use of the vaccines has gone down a little bit, down to 84%, it is really a signal, I think, to all of us that it is really important for us all to step up and decide to choose to be vaccinated, to protect yourself, to protect each other, to protect our state. Because right now we're starting to see some increase in some of the variants. The governor mentioned the P1 variant, which is the first case that we've seen, which is the Brazilian variant. We have stayed stable at 2 cases of the South African variant, but our United Kingdom variant numbers have gone up to 365 from 243, and our California variants have gone up just a tad from 167 to 174. And that is not to scare West Virginians, but it is a call to arms, a call to go to the fire, as the governor has said. And we know that our most strongest age group of spread is the 10 to 19-year-old young West Virginians. And so we really want to call on families, on parents, on young people to get vaccinated. Please choose to be vaccinated. It will allow you to safely play sports, have your activities. If somebody on a sports team gets infected, then people that are fully vaccinated don't have to quarantine. And for all of us with our families, we want to make sure that we can spend time together. And the way to make sure it is the safest is for all of us to be vaccinated. As the governor said, these vaccines are incredibly effective. And we've seen in real world settings the incredible reduction, protection it gives all of us against death and hospitalization and getting COVID-19. The other thing that I'd like to point out to all West Virginians is there was a recent study that came out in the United Kingdom that was reported by the Kaiser Family Foundation. And what it said is that any American, any world citizen that exercises at least 150 minutes a week, which is, just walking 150 minutes, has a significant protection in their looking at all of their medical records from severe consequences of COVID, hospitalization, and death. So it's also important for us as we are, protecting ourselves, making sure that we are staying, distance when we're inside with masks on and being careful and choosing to be vaccinated. But also just simple exercise is a great protection against the severe side effects of COVID-19. So thank you.
Thank you, Dr. Marsh. We'll now go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. Just like to reinforce a couple of items that the governor and Clay have brought up. Number one, as the governor pointed out, we continue to have plenty of availability of vaccines. It takes us longer each week to get those vaccines in arms, not because of the logistics, but because of getting people to get to those vaccines. So we encourage, again, businesses, churches, PTAs, garden clubs, whoever wants to host a vaccination event, we will work with you to get that done, to get you, your families, and your friends and neighbors vaccinated. As pointed out by both the governor and Clay, we are in a race. We have some serious variants coming into our state and across the country. We know the vaccines help prevent them, help slow them, and in some cases stop them. And we need to get West Virginia vaccinated. The other thing I think is important for us from a state perspective, and the governor's talked about this before, as a result of the way we, West Virginia, have responded to this pandemic, people outside look at us differently today. Businesses I've had the opportunity to work with in my new role look at us differently because of the way we're responding. So if we can step up, do what the governor asked, get more people vaccinated, we will continue not only to save lives, and we will change West Virginia's image forever. So greatly appreciate the work that's being done. Please, West Virginia, step up and get vaccinated. Thank you.
Thank you, sir. Next, we'll go to Secretary Bill Crouch with the DHHR.
Good morning, everyone. April is a time of remembrance and awareness as West Virginia recognizes Child Abuse Prevention Month. Child abuse and neglect is a serious crisis affecting every segment of our state, and finding solutions requires involvement and action from every citizen. In 2020, there were 33,858 reports of child abuse and neglect made to DHHR. Our children are our most valuable resource and will shape the future in our state. Child abuse and neglect can have long-term psychological, emotional, and physical effects that have lasting consequences for victims. Communities must make every effort to promote programs and activities that create strong and thriving children and families. Prevention remains the best defense for our children and families. Suspected cases of abuse and neglect of a child or a vulnerable adult should be reported to DHHR's 24/7 hotline. That should be up on the screen. That is 1-800-352-6513. That is 1-800-352-6513. Again, please help us protect our children and our vulnerable adults. Thank you.
Thank you, Secretary. Next, we'll go to Dr. Ayn Amjad, our State Health Officer.
Good morning. Dr. Marsh mentioned all the variants that are across the country, and now in West Virginia, of course, we have seen the P1 or the Brazilian variant. We do have one case here, as mentioned. The best way for us to address these issues are to continue to wear our masks when we're in crowded spaces and social gatherings, also to get the vaccine, which we've been discussing several times here. But we do want to also mention, as far as breakthrough cases, to date, we do have 129 documented here in West Virginia so far. And a lot of people do ask what a breakthrough case means. That basically means if someone has been fully vaccinated. So if you received Pfizer or Moderna, that is 2 weeks post the full cycle of the vaccine. But that's what we talk about when we mean breakthrough cases. But we really want West Virginians to get vaccinated. We have plenty of Pfizer and Moderna available, as General Hoyer did mention. We also want you to take advantage of our testing sites that we have throughout. This is a time that people are gathering more. It's getting nice outside, families want to meet. But as you see, the variants are here in West Virginia, and we need to get vaccinated as quickly as possible. Thank you.
Thank you, Doctor. We'll now go to questions from members of the media. Our first question today is from Kenny Bass with WCHS and Fox 11.
I thank you for taking a moment for the question. I have one for Dr. Marsh. It's almost a theoretical, but it pounds home, I think, some of the points that might be in play today. With the way that the variants are advancing across the country, and we're seeing their advance in West Virginia, and knowing that they are more easily spread, more infectious than the regular strain of COVID. Can you give me a scenario of what we would look like, what the world would look like, West Virginia would look like without vaccination at this point, with those variants in play? Dr. Bruce Vanderhoff, the medical director for the Ohio Bureau of Public Health, had some very interesting thoughts about that yesterday. And I was wondering if I could get what your thoughts would be, what kind of world we'd be looking at, what kind of state we'd be looking at if those variants were allowed to do what they do best, which is spread. Thank you.
Dr. Marsh.
You got
Kenny,
so,
ask you.
So thank you, Kenny. Well, we know and have incredible amount of trust and faith in our citizens that won't happen and hasn't happened. But let's just look at the country of Brazil right now that has the second highest number of cases of COVID-19 in the world and is seeing the variant that we just talked about in Brazil. They have found that in the country of Manal, that people have been reinfected with the virus who had the virus before, and they're seeing younger and younger people go into their ICU. For the first time in their history with COVID, they have seen the predominant more than 50% of ICU patients being under 30 years old. And so as we look at Brazil, as we look at Michigan, that's been a pretty good vaccination state, who still had a huge amount of problems with the United Kingdom variant. I think what we see, and what we are all really calling on every West Virginian to respond to run to the fire, as the governor said, is the fact that we have this great opportunity right now to prevent all those problems, prevent any of those scenarios. And the two ways to do that, most importantly, number one, is that we continue to be very disciplined and to wear a mask and stay physically distanced when we're out, particularly when we're indoors, and be careful, be courteous to other people by making sure that we are protecting ourselves and therefore we protect each other. And the number two, and most important, as we've said many times now, is to choose to be vaccinated. These vaccines are incredibly effective, and they're also incredibly effective against all the variants. And as we said, every life is obviously critical, to all of us, and we don't want to lose a single person in West Virginia, in our country, and in our world. And these vaccines make a big difference. And I, praise the people of West Virginia and the governor for his leadership, but we have done so well so far. And we have an incredible opportunity right now to really all of us answer that call. And by being vaccinated, we will prevent any such scenario from ever happening in West Virginia. And that is really what we hold the dearest, is that we want to protect every life. We want to protect every community, every family, and we want to be a light for others. So Kenny, thanks for that question. And that is really the reason why vaccination and wearing masks and doing those mitigation measures are so important to prevent those kind of trouble, those kind of problems from coming to us.
Kenny, I think your question, was what would West Virginia look like? If in fact we didn't win the battle as far as people being vaccinated, what would West Virginia look like if these variants really get hold and take off? The answer, Kenny, Dr. Marsh can give you a sophisticated answer, but the answer is just this simple. West Virginia would be a lot of sad singing and slow walking. There'd be a lot of people die. Now, people kind of brush that off right now in a lot of ways, and that's really not hitting home with them. Now, I know it's not hitting home because we're standing up here begging them all across our people, our experts, to go get their vaccination. We're begging them to not die. That's what we're doing. What would West Virginia look like? What would West Virginia look like if this were running through our streets like crazy? We managed along the way to keep West Virginia's economy running, to keep ourselves open, to be in school, to be playing sports, to be absolutely doing the things with our fairs and festivals and getting back to life as we all want it to be. Now, we did that because we managed it. And we did that because the people of this great state listened. Now, I can tell you exactly what we would be. If these variants took off, and they can, and we know they're twice as infectious and twice as deadly in many situations, what would we look like? We would be running through the streets saying, we got to close this, we got to close that. without any question whatsoever, we wouldn't be standing around saying, well, I don't like this mask. Well, let's just get rid of the mask. We wouldn't be debating that at the House level or the Senate level here. We wouldn't be debating these issues, would we? In fact, we would be running from this killer like crazy. Can that happen? Of course it can happen. Should we be vaccinated? Of course we should be vaccinated. All the data in the world tells us how safe it is, and absolutely without any question we should be vaccinated. I hate to say it this way, but it's just fact. And the people of this state have always known that I speak the truth, and I speak it bluntly. And I'm telling you just straight up, we shouldn't sit here and be pleading and begging with our population and our people to go get vaccinated. Without any question, if we don't, I read 21 today, right there they are. There are 21 great West Virginians. 21 people today died in West Virginia in the last couple of days. If these variants catch hold and we aren't vaccinated in the state of West Virginia, we will absolutely have a catastrophe. It will affect us economically. It will affect everything we want to do about school. It will absolutely be a disaster if we have the variants go crazy. Now, if you're a person that believes, oh, this thing's over, I mean, Justice, just be quiet, this thing's over and everything, and you believe that, an ostrich sticks its head in the sand, and if that's you and you believe that, and this thing turns around and whiplashes on us like crazy and everything, shame on you. Really and truly, we have told you over and over, West Virginia, you've got to get vaccinated. We have said we'll come to your house, your businesses, your schools, your churches, whatever it may be, and here we sit begging you to go get vaccinated. I know where we'd be, Kenny. I know exactly where we'd be if this thing would turn really, really, really ugly. It would not be good. Okay, Nathan.
Thank you, Kenny. Our next question will be from Mark Curtis with Nexstar Media.
Good morning, everyone. I apologize. I'm in a doctor's office and I have to step out. I don't want to commit any HIPAA violations. Speaking of which, I was seeing my neurosurgeon this morning and told him about the Brazilian variant being detected. And he said he heard that the Brazilian strain is resistant to at least the Pfizer vaccine. I'd like you to address that. Are any of these new strains in some way, shape, form, or fashion resistant to some of the vaccines, or are these vaccines pretty much going to be a protection for everybody, and no matter what the strain?
Maybe Dr. Amjad, we haven't heard from you.
Hi, Mark. Sorry we pulled you up from your doctor's visit, but so to answer that question, some of the vaccines, at least for the UK variant and the California variant, do offer some protection. The Brazilian variant and the South African variant have always been some concern. There are concerns for the treatments like the monoclonal antibody treatments. As far as the vaccines go, there is concern that it's not as effective, of course, with the Brazilian variant, but that is not to say that you don't want to take the vaccines, because it does offer some protection. And you'll see different reports of percentage-wise, but it is still going to offer some protection against the variants, including the Brazil. I'm not sure if Clay has anything he wants to add to that discussion.
Thank you, Ein. Yeah, in the laboratory, some people have tested some of the antibodies, Mark, and had some, seen some difference. But in real life situations, all the vaccines work really well to protect people from the most severe complications of COVID-19 infection, including hospitalization and death. The key about the Brazilian variant, which is something that we want to pay a lot of attention to, as many others are as well, is the native immunity. So people that have had COVID and gotten better from COVID, native immunity doesn't seem to be as perpetuated, doesn't seem to be as good with the Brazilian variant. The reduction in native immunity to be able to to prevent you from getting reinfected with COVID is only about 50 to 70% in people who are potentially going to be infected with the Brazilian variant. But the vaccines work much better than that. So that is really a critical reason why right now, particularly, we want people to choose to be vaccinated, because the vaccines are really very good at protecting people even from the South African and the Brazilian variant in real life settings.
Thank you, Mark. Our next question will come from Mark Cram with WDVM.
Good morning, Governor. Good morning to everyone. I'm always excited when I get emails from viewers who want to know about the questions. Today, someone from Berkeley County asked me, they're planning the summer concert series for Berkeley County. They want to know when there may be some guidelines or instructions on outdoor concerts, when that will be forthcoming. And my second question, today in today's New York Times, there's an article that mentions that West Virginia and Alaska were the fastest start states in regards to distribution of vaccine. However, the article points out that there seems to be a trend with red states that there's a lesser percentage of the residents are stepping up. Blue states, red states, we hate to see this turn into a political thing. Governor, I want to get your comment on this because I think the message from your administration has been crystal clear. Thank you.
Mark, as far as the guidance on the outdoor concerts and everything, I think the guidance are out, and but if they have specific questions, I just say to call us. But I think the guidance are already up and everything, and they can go and look. But if they have a specific question, like I said, just call us. From the standpoint, Mark, of there are more people in red states that are hesitant. I've seen that. I have no reason to disbelieve the data that of what people have come up with, and saying that there are more people, more Republicans that are hesitant about the virus than those in blue states. But my feeling is just so simple. It's just this. I hate to think that the only thing that is going to snap us into reality is the body bags. I just it doesn't matter, red state, blue state, Democrat, Republican, whatever it may be. We really need to be listening to the experts and listening to your governor and listening to all those in the medical community all over the place, and be getting this vaccine. West Virginia was, like you said, Alaska and West Virginia led the way. I don't know much about Alaska, but I know in West Virginia that you had a lot of people out there all across the world that were thinking, and here's exactly how they thought. They thought, West Virginia, those people are backwoods, those people are non-educated people, those people are poor people, and they're backward in their thinking and everything. And we know West Virginians aren't going to take this vaccine. There's no way they're going to take it. They're the reddest of all states, and they're not going to take this vaccine because these people are backward thinking. And we changed all that, didn't we? We really moved the needle, and we changed all that because it was wrong thinking. It was wrong, but that's what the outside world thinks and thought. And we changed it all. We became the diamond in the rough that everybody's been missing. We became the leaders. The state that they thought would be dead last were the leaders. Now, I'd hate to think that then there are factions right in our own midst here, that are pushing propaganda out every day. We don't need to wear the mask. We don't need to do this. We don't need to do that and everything else. And honestly, if this thing turns really ugly, what would be such a crying shame. I don't like the mask either. The mask is inconvenience, but absolutely we know that it saves lives. So from the standpoint of inconvenience, well, we put up with the inconvenience for a little while. What are we going to do? What are we waiting on? Are we waiting on the ambulance showing up at the house? Absolutely the morgue taking in over and over more and more and more of our folks until we say, oh, dang, I need to go do this. Well, that's just not very smart, but Mark, I don't have any reason to disbelieve, the thought that more people in red states, but it doesn't matter, does it? It doesn't matter. All that matters is this. We're not Democrats and Republicans, we're Americans. And we need to lead the way. West Virginia needs to lead the way. Absolutely. When you're looking at a vaccine that is a 0.0000 whatever one, as far as any kind of downside problem, and the upside is 21 right here today. I mean, is there any choice in that decision at all? And so, Mark, it doesn't matter to me about the red and the blue. All that matters to me is all about West Virginia, all about our nation. So I'm going to keep preaching the same sermon. Thank you.
Thank you, Mark. The next question is from Joanne Snotterly with WV News.
Hi, Joanne Snotterly, WV News. You've talked a lot about the increased transmissibility and lethality of some of these variants. Do we have any data yet that you could share on how much the variants are contributing to our new hospitalization and death rates in the state? And also, can you tell me a little bit about our capacity for variant testing in West Virginia? How many samples are we able to test, and how many are we testing each day? And are there plans to expand the number of samples that we're testing for these variants so that we kind of have a better picture of where they are and who's being impacted? Thank you.
Dr. Marsh, that's you, sir.
Well, thank you, Joanne, for the question. Certainly, we know that as the variant viruses continue to expand in West Virginia, that it will very much likely lead to more spread. And as we've said repeatedly on these press briefings and other venues, we are seeing spread COVID-19 in younger and younger West Virginians. Our biggest age category is 10 to 19. We're also seeing increased number of cases in our 0 to 9-year-olds over our last 7 days, and other of our younger people's categories. And this really does suggest that viruses that are more transmissible, that bind better to the cells of our citizens, like the United Kingdom variant, are likely responsible for at least part of this increased spread. And that's the reason why we've asked for a call to arms for all West Virginians to choose to be vaccinated, because now is the time. General Hoyer said that today. We're in a race between the number of West Virginians we can vaccinate and the slowing of the spread of these variant viruses. We have substantial capacity in the state to be able to sequence more and more viruses. We have worked between West Virginia University and Marshall University to design the molecular laboratory that has the capacity to expand. So currently, we are testing in the order of 300 or 400 cases a week, and we are expanding those numbers as we get more samples. Just as a really quick primer for how we do this, we have to have a PCR test that's positive. So it can't be an antigen test, it's got to be a genetic test. And there has to be enough virus in that PCR test, and we assess that based on a certain number of parameters, but there needs to be enough virus that we can sequence that virus. And we're also working with some of our partners with LabCorp and Quest that are also sequencing. So our own capacity, we're expanding and we're getting more samples, but we also have additional capacity through our partners. And we continue to watch that because the rate of speed of that variant spread is really going to have the direct, impact on the outcome in our state, in the people that aren't vaccinated yet. In people that are vaccinated, they will be protected against the, any severe manifestations of these variant viruses.
Thanks, Joanne. Our next question will be from David Beard with the Dominion Post.
Hi. Before I get to my question, I wanted to quickly clarify something Dr. Amjad said about breakthrough cases. Were you talking about people who are fully vaccinated and got sick anyway? But to my real question, kind of following up on what you've talked about today with the variants and the kind of slackening pace of demand, to use a sports metaphor, it sometimes feels out here that a lot of people are sitting on the 3-yard line and thinking they scored a touchdown and won the game. But have you done any kind of like number crunching projections looking at the pace of supply and the pace of demand to project like how many months in reality we are away from getting to a saturation point where we could feel like we really are over the hump? Thanks.
General Hoyer, that's you, sir.
Yes, sir, Governor. So, David, so we are at the point now where supply is above demand. So our efforts now are to continue to educate people and to continue to make it as convenient as possible for people to get the vaccine. We have plenty of vaccines available. We are continuing to update, and we'll have next week updates on numbers that we have been crunching with CDC to get a better picture where we blend together the data that we have with the federal data, and a team from DHHR, West Virginia University, and the Interagency Task Force are working that. But we know that as the governor pointed out, the great news story is we're above 75% of the people over age 65. And while that has drastically reduced our death rates, as the governor announced today with the 21 West Virginians we lost, it has not stopped it. So we've got to go forward with the governor's objective of 85% or higher in that age group. We know that the younger age groups are spreading the virus quickly and are getting much more sick. So we've got to press on that. So right now, supply is good. The effort is education and making it available conveniently to get more people vaccinated.
Thank you, David. Our next question will come from Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. It looks like the vaccination rates are dropping off precipitously in the last couple of weeks. Since Sunday, it looks like there have been 13,667 doses administered. That's about less than half of what was done during the same period last week, and only about a third of what was done during the same period 2 weeks ago. Do we have an explanation other than the red state, blue state as to why the vaccination rates are dropping off so dramatically?
Well, I'll Phil, thanks for the question. I'll defer to General Hoyer, but before I do, you know, a lot of it, Phil, is nothing but math. I mean, you know, if you're fair again and you look, we've put doses in arms in West Virginia of 1,146,914 people. And of that, hold it just one second. I want to be right on the money when I tell you this. Just a second. Of that, we've put 680,613 first-round doses and 480,870 second-round doses into people's arms. Now, the mere fact that in the state of West Virginia, all we've got is 1,700,000 and some thousand people, and we've got almost 700,000 of them with a first-round dose, and we're following back up with the second-round doses, we're running out of people. I mean, you know, if you throw in that 1,700,000, you've got some, you know, goodly many of kids that are between age 0 and 16. So I don't know exactly what that number is, but if you throw in the kids and you throw in the ones that we've got first-round doses, that's 700,000 right at that, and the kids on top of that. And so if the kids happen to total 300,000 in the state, and I don't know that that's correct or not, but if it were, you've got a million folks that basically now you're down to where you've got 700,000 people or 800,000 people, whatever the number may be, and now the low-hanging fruit, the people that were really, you know, wanting to get their vaccine, they're kind of out of the way, and now really it just falls back on education, and we've got to get to the. I mean, we just keep working it every day. I mean, that's all I know we can do.
Governor, I would just add, I think you've hit exactly where we are in West Virginia was fast and upfront, and we put a lot of vaccines in arms exceptionally quick, and you're going to see a natural tail off in those numbers as you work through the last group of folks who've reached some level of hesitancy in the vaccine. But the good news is we stay focused strategically on key populations that we need to continue to get to quickly, and that's particularly our 65 and above population, where we continue to make great progress moving forward. And as the governor pointed out, we're going to continue to educate people, and we're going to continue to make it as convenient as possible to get shots in arms. I don't worry as much about national numbers. My job's to worry about the strategy of this with the governor and with Clay and Bill and I, to make sure we're getting to the right folks as quickly as we can.
Thanks, Phil. That was our last question. Governor Justice, back to you.
Before we go close, let me just add this. Our people real quickly found out that there's almost 400,000 kids in West Virginia that are age 0 to 16. You know, if that be the case, Phil, just do the math, please. Just do the math. You know, if we've gotten in arms almost 700,000 first-round doses and 400 and some thousand that we're following up and getting the second dose, forget the second dose for right now. Just think, we've gotten in arms 700,000, 680,000 and change. Then we have 400,000 kids in the state of West Virginia. You put them together, now you're down to you're 650,000 people. Well, I mean, it's just simple as that. We don't have to We don't have to start thinking red, blue state and everything else. I mean, for crying out loud, we're down to a population that is somewhere around, 40% of our population is still needing a shot that is age eligible or hasn't had their first round shot. 60% of the population is either not age eligible or already has had their shot. So when it really just boils down to it now we're really just trying to reach out, educate, and take to finish this thing up as best we can with everybody that we can possibly get to get vaccinated. Now, so it's a big education process. I want to close, though, with just this. This morning before I left and everything, Kathy looked at me and said to me, she said, because there was something on TV, I don't know if it was on one of the CNN or Fox or one of them, I can't recall. But they were talking about people and their hesitancy, across the nation to take the vaccine. And Kathy and I, we'd been talking about the little girl on my basketball team that had tested positive and the fact that probably it's going to throw us, into a tailspin. We were in the middle of the basketball, the state tournament and not the actual state tournament, but we've got kids that are on this team that last year that were at the state tournament with a real shot to maybe become state champions, and then all of a sudden the rug's just jerked out from underneath them and everything's canceled and it's over. And now this year they just won a nice sectional game the other night against Princeton, a really nice team. And we surely don't have a team that is probably capable of moving on and, becoming a state champion. But we do have kids that have played hard and they're wonderful, wonderful young ladies and everything. And now they're on the verge of the exact same thing happening to them that happened last year. Their season just jerked right out from underneath them again because we have somebody on the team that's tested positive. Now, Kathy then turned to me and said just this. As she watched the news, and the news was saying over and over about the reluctancy or the hesitancy that people were having about taking the vaccine. And she said, Jim, I just don't understand it. I really just can't get it in my mind. I just cannot get my hands around how people could not take this vaccine. Every single thing that we tell them, every single thing that the experts say point to the fact that the likelihood of a problem with the vaccine is almost nothing. But every day I listen to you read off name after name after name of people that died. I don't get it, Jim. I don't get how in the world anybody could not take the vaccine. There was a point in time where we were scared. We were scared. And absolutely we announced that we were going to take the people 80 and above, that those people thought there was no hope for months and months. And when we announced that, we were absolutely covered up with people. We absolutely couldn't keep up with the people because people, just to tell it like it is, they were scared. Now you've got to ask yourself, and you've got to ask yourself just this question. Today, are you afraid today? Are you concerned today? And if you're not, then absolutely you've just got to whistle through the raindrops, don't you? And hope and pray that this thing doesn't turn and bite us. When it all started, there was many of us that we weren't afraid. We absolutely didn't have a concern in the world. And as we whistled through the raindrops, all of a sudden this bit one of our loved ones. And when it did, then we heard this over and over. Oh, I wish people would now hear me. I didn't believe this. I really didn't believe this was a problem. But please, people, listen to me. Please, people, listen. This is the worst thing on the planet. This is absolutely a killer, and absolutely it is the worst death. Please listen to me. I have heard it 1,000 times. Absolutely, we weren't afraid. We weren't afraid. We weren't concerned. And then it bit all kinds of people right in our state. And when it did, they became believers beyond belief. And now, like it or not like it, we're in a situation nationwide to where today we're not concerned. We're not concerned nearly to the level that we should be. We can finish this up, but I'm a real believer in life that fear and concern can be constructive. Now, I don't mean to scare anybody, but I am telling you with all in me, we still need to be concerned. The toughest part of the mountain is always the steepest part, and it's really right near the top, always. We can get across, or we can slide back down. You slide back down, it's going to be some sad singing and slow walking, so we absolutely need to keep our guard up, West Virginia. We can get there. Listen to Kathy. Listen to Kathy say, I don't get it. I don't get it. This vaccine has almost no risk. I don't get it. Why in the world are we not finishing this up? Why are we not winning the race when the race is right in front of us to win? Why in the world have we run so hard around the track over and over and over, and we've lapped the field, and now we can see the finish line. We can see the tape across the track. And now what we're doing is we're just absolutely walking around in a circle, and we're looking up in the stands, and we're doing everything except running through the finish line. You better listen to me, West Virginia. You better listen to Kathy. She's got this one. Thank you a bunch.